and we can roll right into our COVID-19 update. Board members, we have again our health partners here today from Boulder County Public Health, Broomfield Health. And so, Randy, I'm not sure who's starting with the presentation. I think that we're turning this over to Dr. Urbina, I believe.
Yes, thanks, Randy. Thanks, Rob and the board. I'm a poor second to Jeff, and I'll do my best to try and present the data, and certainly will be available for questions. So, as you know, Jeff has often presented this set of slides, and so many of these look very familiar to you. I just wanted to point out on this slide that we're still in the red on our dial, but we've actually decreased our incidence rate to 644. In the past, it's been above 700, so actually we're doing a little bit better, and I'll talk about that as we go through the slides. Next slide, Randy. So this is our 2-week testing positivity rate. As you know, that's the number of tests that we do and the number of positives. This has actually gone down significantly. We're still having great success in getting people to get tests, and now our positivity rate is 6.7. Prior to this latest surge, it was hovering below 5. I think it got above 8, and so now I think we're heading in the right direction. Next slide, Randy. This is our hospitalization status, and I'll talk a little bit more about this later as we talk about those decreasing. This is one way of looking at it, that we are showing that we are now in yellow zone.
Escuchando ahí la reunión.
Señora, déjame seguir con esta presentación. So what I'm saying is that I may need to speak a little bit slower, that we're showing 8 days of decreasing or stable admissions, and this is a better way of looking at it in our next slide coming up. Next slide. This is our new case rates by county. This is a very useful slide, one, because it's colorful, but it also puts us in comparison to other counties in our community. I know Helene will talk about this a little bit later, but you can see our red and Broomfield are on the lower end of things, which I think is good. We're actually decreasing. At least we haven't yet seen the impact of Thanksgiving yet. We're allowed to see this week, but it's important to know that we actually had a decrease in our cases, and Boulder and Broomfield are doing at least better in this situation. Next slide. I think it's also important to point out, and I'll talk about this in our long-term care facility, we are still seeing a significant amount of newly reported cases. It's still a significant problem, but it seems to be going down a little bit, and we're unfortunately starting to see an increase in the amount of cases in our long-term care facilities. Next slide. Again, this is another way of looking at the average of incidents. We're seeing, and this is a very positive trend, as I talked about a little bit earlier. We're seeing that 5-day average actually begin to drop. As of December 4th, I think is the latest data, that number of new cases, 128. That's a positive direction, but we still haven't seen yet the impact of the Thanksgiving break. Next slide. This is also important to point out because I do think it's relevant, particularly in the issues around disparity and folks living in Longmont. This is an important slide because we can see Boulder is the dark blue section. Longmont has the significantly higher number of testing positive. That's the light blue. And in Lafayette, Louisville, and Superior are slightly less than that. But we still see a big chunk of cases still occurring in our northern part of our county, particularly in Longmont. Next slide. This is an important slide, and I want to share this, and I know Jeff wanted to share this with the board as well, that compared to our previous 2 weeks where we saw a rate significantly higher of kids that are in our early childhood, as well as our 5 to 9, our 10 to 14, and 15 to 17, that we were significantly higher in the 2 weeks prior to this last 2 weeks, and the rates have dropped are going in the right direction. And we're not sure exactly why that is, but we see this as a very positive trend that kids are having less numbers of cases. And that may be because they're not in school, and that may also be not because maybe because they're not being tested since they're not in school and identified with symptoms. But it's still a positive trend, and I just wanted to share that data with you. Next slide. This is a slide often Jeff shows, and I think I want to point out a couple things. You can see that overall, all of our cases in all of our age groups are decreasing, except for one. And I'm going to refer to the 75 plus, that's the dark maroon, and you can see that buried in the middle, but that's the only one that's actually increasing. And that's very concerning, as we've talked about before in previous Board of Health Education meetings, is that our most vulnerable population, particularly the elderly over the age of 75, are impacted. And that's probably why we're seeing an increase in both numbers of cases in our long-term care facilities, as well as in hospitalizations in this age group. Next slide. This is another way of looking at it. I alluded to this a little bit earlier, and again, this is very disheartening from my perspective as a Latino, that we're still seeing a significant numbers of Latino, Hispanic population affected by cases in this population. If you look across the board in all the slides, it represents a significant portion of our cases in the Hispanic, Latinx, Latino, Latina populations. So important to point that out each time we come to it. We're still working with our community partners, and I'm certainly able to answer questions later on as we go through this. Next slide. This is another way of looking at our positivity. We've seen a somewhat decrease in the number of testing sites, but it's still, our positivity rate is going down, and that's a positive sign in many ways. Next slide. Another way of looking at our 5-day rolling average of positive results, although I alluded to this earlier, this is the last slide. It shows that we had a very increase significantly. We went above 9 early on in November, and now we're seeing this. We had a significant drop prior to Thanksgiving, and now we're up a little bit, but overall that trend is still much less than we've done in the past. Next slide. This is a very important slide that I wanted to talk about, and hopefully we've all have our fingers crossed that this is an extremely positive trend, and I'll summarize that at the end, that we're seeing, and maybe it's because people are beginning to take greater protection, and maybe it's because we still haven't seen the full effect of Thanksgiving and the intergenerational visits that happened during that period of time. But we are still seeing a positive trend, that is a positive trend in decreasing numbers of hospitalizations. We see that in this case, a negative trend is actually a better outlook in terms of hospitalizations. Next slide. This is a very busy slide, and we often talk about this, but it's still, particularly the orange associated parts of this graph are deaths. And as we talked about earlier, anytime we start to see an increase in number of cases among the 75 and older, and then we're very concerned about that death rate. And that's still a big problem, not only in Boulder, but all over the state. Next slide. So this is an important, getting back to, advance the slide, Randy, thanks. To the green slide. There you go. So these are important metrics that we're beginning to monitor because of the concern about hospitalizations that we saw a little bit earlier. Even though I showed you a slide where we were starting to see a drop in hospitalizations, I just wanted to talk about this metric, which is level purple on the dial that we've talked about in the past. That at this point, Boulder hospitals, and we talk to them weekly, are not approaching crisis standards of care as of 12/1. And what that means is they're basically going to have to ration, as well as potentially stop admitting patients. So at least at this point, we're actually doing quite well. We're not at this point looking at an alternative care sites. That's a good thing. And most of the hospitals are reporting sufficient personal protective equipment, which is PPE, for the next week. They are still having problems with shortages. I think at the last Board of Education meeting, Jeff talked about this. The issue is not necessarily beds or the actual structure, but it's the staff. And I think we're still 40% hospitals are reporting staff shortages, so we're trying to work with them closely. Now, the challenge in the past has been that when you had a state next to us or states around us that may not have the same problem, we could always recruit staff from those areas. But now that we see the hospital challenges all around the country, every hospital in every state is having problems with shortages. Boulder is no exception to that. Finally, I wanted to just highlight the issues. Even though we're not in crisis mode, it's still a significant problem that we see 70% of medical surge beds and 86% of ICU beds are in use. I think that's a big deal, not only because they're being filled with COVID patients, but obviously if you have a heart attack, a stroke, or some other medical issue that you are in need of an ICU bed, then those beds are not going to be available. And so we're very, very, very aware of that, and we're very concerned about it. Again, a couple of issues. There's tight ICU capability, as well as, and you can see the rest of the data. Next slide. This is another way of looking at hospitalizations. You can see we peaked late at the end of November, and now we're starting to decrease that hospitalization rate, and hopefully this trend continues. Next slide. This is I'm not going to spend a whole lot of time on this. Is a relationship with COVID cases and percent of all ED visits. We're starting to see a little uptick of flu, but it's not significant in terms of hospitalizations. But I think it's important to point out that we still have other issues in Boulder County. Flu starting to rise. We're still seeing a rise in cases still coming to the ER for COVID-related issues. Final slide, Randy. Sorry. A couple other things around distancing. This is a very busy slide, but I think the state does track this based on cell phone data. This is in Boulder County specifically. In the past, we've had significant issues around social distancing. In April, we had a big 86% of people were social distancing based on their cell phone data. We're kind of hovering around 54%. We obviously wish this would be better, but it's not. But it's a way of tracking people to see how much they're focusing and how close they're getting to each other. Next slide. This is way too busy to present, but basically it shows that way back in April and May, and that's the big peak on the green or the teal slide. Back then, people were staying at home much greater than they are now. They dropped. We actually had lots of effects, very positive effects with our policies, where people started to drop down, more stay at home. You see the drop in the curve there, and then unfortunately, people are starting to get out more as we go up, and you're seeing a positive trend greater than 50% now. Next slide. So this is some issues that I know the board will going to want to chew on a little bit. Recently, the public health order, statewide order, categorizes educational institutions as critical businesses for the purpose of providing critical services to students and the general public. K through 12 are considered critical for the purpose of providing meals, and you all know these issues. Data suggests that there's a low risk to have in-person learning for grades K through 5, slightly increased risk for grades 6 through 8, and of course 9 to 12 are at the highest risk in the school settings themselves. We still believe, and this is taken from the CDPHE in-person learning in the time of COVID for schools, that we still think that the transmission appears to be happening from interactions outside of the school day and then brought into the school, as opposed to widespread transmission occurring in schools. And I wanted to summarize this because it's important data. And as I pointed out earlier, we're seeing a decrease in the amount of spread among those school-age children. So it's something to chew on, and certainly I'd be happy to answer questions about this. Next slide. So this is our latest picture, and this is our summary slide as we've heard before. The number of cases have stabilized and decreasing somewhat in certain age groups, except for the folks over the age of 75. Hospitalizations are decreasing statewide, and we're hopeful that trend continues. But it's still, the cases are still very high, and we're struggling, frankly, to keep up with all the contact tracing. And I know the schools were as well, so this is an issue for all of us. Right now, we're estimating that 1 in 40 people statewide are infectious with COVID-19, which means to me that it's still not safe. And we're also waiting to see the impact of Thanksgiving, as I alluded to earlier. We should know this week. As you know, it's 14 days of incubation. Most of the contacts happen beginning this Wednesday and beyond. So we're probably going to see some of those effects in our data this week, and please refer back to our website if you'd like to see some of that. The Colorado School of Public Health modeling that we've talked about on this presentation. Later on, we'll have this update, and of course, the issues of increasing incidence, hospitalizations are all factors in terms of decisions around school across the state. I know there are going to be lots of questions about vaccine, and certainly Helene and I can answer those questions. But after this Thursday, Pfizer is going to be approved likely by the FDA, and quickly lots of vaccines are going to be shipped across the country. We don't know the exact number, although it'll be proportional, likely to be over 40,000 cases initially for the state. Those will be distributed statewide. Boulder County, and I know Broomfield Public Health is also actively participating in this in terms of understanding where the vaccine is going to go first. All regions will get vaccine, but remember, as we talked about in the past, those prioritizations will be for hospital and healthcare workers, as well as long-term care residents and their providers. So we'll be talking about that more, and I'll be certainly able to answer some of your questions. Thank you for allowing me to present on Jeff's behalf. I rushed through those slides much faster than Jeff would, but hopefully we'll have time for Helene to present the data in Broomfield and then have time for your questions. Thank you.
Should I go ahead and share my screen now? Hi everyone, I'm Helene Lanzer. I'm the Public Health Nursing and Epi Administrator and Manager in Broomfield Public Health. Can you all see my screen correctly? Can you guys see my slides?
Yes, we can.
Okay, so just to follow up on Dr. Biener. Dr. Biener is our medical officer as well, so we work really closely with him and Boulder County Public Health and Boulder Valley School District teams. So thank you for having us here, and I'll just add a little bit more on to what Dr. Obina shared. As everyone knows, the level dials, we had the color purple added in terms, and then changed some of the information and restrictions and such in the red level to kind of just help kind of set the stage more in terms of trying to keep people safe, but also trying to keep businesses open and strike that balance of safety and limiting COVID spread. So in Broomfield County, we continue to see a fair amount of cases. I know one interesting nugget in terms of where our cases are. We are obviously much smaller amount of cases than other neighboring counties, but within March through October, we had about 1,000 cases, and in November we had 1,000 cases. So that's just really a staggering point to kind of drive home how much of an increase we've seen in cases. And so in terms of our 2-week incidence, and that's been hovering in the 600, so 610, so that falls in that red zone, that red level. Our positivity rate has also continued to hover in the 9%, so we've seen it at 9.4, 9.2, fluctuating to 9.0. And our hospitalization rates are fairly stable, 11 days of declining or stable in stable hospitalizations. These are just some pulled out visuals just to kind of show the trend of positivity rate. And when we look at from June on, we know that that's when we started to have more access to testing just community-wide. And so it's a nice visual to kind of just see how much higher our positivity rate is. And as a reminder, positivity rate is the number of positive tests coming back of all the tests that are reported electronically throughout the state. So as I shared already, in Broomfield, we're seeing in and around 9%. Our cumulative or 2-week average in terms of cases is 610 per 100,000. And as you can see there, that's also from June, how significant that uptick has been. Again, mirrors what I just shared at the beginning in terms of how many cases we've seen in Broomfield County and our neighboring counties as well. In terms of just kind of getting a sense of where are we at with where does the breakdown look in terms of different age groups, we've seen this pretty commonly all along, and that 20s and 30s and 40s age group definitely tends to be our higher age group. So 26 to 34 has been teased out as kind of the highest, but they're all very, very close. When we think about the school age level group in terms of that 6 to 18 age group, we're close to 12% of all our cases in November are in this age group. So definitely have seen an increase in our younger kiddos from anywhere from 0 to 18, and then the rest of the breakdown as shown in terms of people in their 50s, 60s, and then upper 70s and 80s. This is another visual just to show kind of what we're monitoring in terms of when we saw, so that dotted line represents when majority of schools were definitely back in more in-person learning. That we started to see an uptick kind of happening kind of mid-October, and then that's just been an ongoing trend even after schools have closed. Not closed, remote learning. And so this is just a calling out a visual of just the uptick that we're seeing. And in terms of, where we see some jumps, all the age groups are seeing that uptick, but we definitely see about 75% of an increase in our elementary age kids from late September to when we look at kind of November, and around 31% with our middle school age group, and about 43% of an uptick in this last month with our high school grade. And again, because a different graph sometimes resonates better for different people, so just wanted to show just kind of a comparison of what we've seen from April through each month in terms of that age groups. And I really think this one, it just represents it visually really nice in terms of just showing you how many more cases we're seeing. And part of that is testing. We're doing much better job. We have a lot better access to testing. We are able to identify and recommend testing quicker, and people have access to it through various locations and sites and through their provider, as well as we know that there's a lot of other events and gatherings that may be contributing to some of these increases in cases in these age groups. We usually like to just try to highlight, similar to some of the things Dr. Urbina shared, just some community trends or things that we notice in our case investigations. As Dr. Urbina said, there's so many cases. It's not possible for all the health departments to reach out to all the cases. So I know one big take-home message is that if anyone is testing positive, it's really important for them to think about and identify their contacts and really quickly notify them as having an exposure, because they may not be contacted by a health department. And so it's just so important to kind of quickly get someone quarantined. In terms of where we've seen that ongoing transmission, it's very common in household transmissions. It's real. We hear a lot of our cases, extended family or their close group of friends, or friends that they may be often or with, or do different gatherings, small gatherings with. And a lot of times people let down their guard more with that. And that's just why it's so important to wear a mask and really still maintain that distance, really still limiting those activities, really just trying to stick more to just your household, your core household group of people. And in terms of symptoms, we still hear a lot of cases with this as mild symptoms in the beginning. We hear commonly headache, we hear commonly runny nose, sometimes GI things like diarrhea. And a lot of times people don't make that connection that it's COVID, and they don't even kind of question it. And one of the most common things we'll hear is people will say, well, I don't have a fever, so I didn't think about getting tested. And we just think that's so important to make sure that everyone in the community listens to that and pays attention that only about half of our cases end up having a fever at all. So it's definitely not the only telltale symptom to watch for. And just a reminder of some of these mild symptoms like headache, runny nose, congestion, fatigue, another really common one that we hear. We, as Dr. Urbina said, alluded to, that we definitely are watching in terms of if we're going to see what additional uptick we're going to see with Thanksgiving holiday. I think that a lot of Coloradoans really did buckle down and really did do that, that hard choice of limiting their exposure, staying home, staying small for that Thanksgiving holiday. But we will continue to watch how these cases trend, and we've got more holidays as the month goes on, and so this is definitely a hard month with mental health and wanting to, missing the things that we normally get to do. So it's definitely hard, and a time to support each other and just kind of be patient with each other, because we're all kind of missing and tired of that COVID fatigue. And as we've seen before, that just cross jurisdiction. It's not that it just stays in Broomfield County. It's not just stays in Boulder County. We know that there's touches happen in a lot of different settings across different counties through different activities, work exposures. We're seeing more cases and outbreaks in child cares and child care centers, and as well as at other kinds of local events and religious events and work gatherings activities. And just quickly, just to add a little bit more similar to what Dr. Urbina shared, we are excited and hopeful about the vaccines that are coming. The FDA will be meeting this week to talk about Pfizer and I believe next week for Moderna. So that's very exciting news, and safety is absolutely an important, critical piece of this, and it is being thoroughly reviewed to make sure that it is a safe rollout for all age groups that will be receiving the vaccine. The CDC, state health departments, and all the different local health agencies are working together. We're working also with hospitals. We're working with pharmacies. It's a really amazing group collaboration, but it's unlike anything ever in terms of the mass amount that we're looking to do in such a short time. So there's a lot of planning, a lot of logistics still to be figured out, and changes literally daily. And as this kind of keeps rolling out, so we'll continue to try to keep the public informed. There are priority tiers, as we've shared. There's likely to be about 47,000 doses in that first initial rollout, and more to come, mostly each week is what we're hearing, and more to come as we roll into 2021. So we will have to continue to finalize those priority tiers, and looking at healthcare providers, long-term care residents and staff, other first responders, and other critical staffing. And so that will be finalized as part of the FDA's conversations with CDC and the state health departments. And that 2 initial vaccines that are coming out, they're expected to be 2 doses, and they vary slightly in terms of, one is 21 days for the second dose, one is 28 days, and more information will be coming in terms of just things to watch for side effects. After the FDA meets, we'll have more information on just kind of educating the public on what to expect on those vaccines, and many more on the expected forefront coming February 2021 and so on. And then just to share our information, our website is broomfield.org/COVID, and we do track a weekly scorecard as well. We've talked about how important the messaging is at reversing the trend. We're still in that phase where we really need to turn down the trend of the uptick that we've seen happen, and hope that we can get through this year with less cases and less deaths. And thank you for everybody's ongoing partnership, and we're, as Dr. Urbina said, happy to answer any questions. I will stop sharing.